Hey you guys, some of you may have seen the live stream from the road. I've been on a trip. I'll tell you what that's all about, but first I gotta take a shower. Okay, much better. I spent the last 3 days off-grid with board certified trauma surgeon and flight medic Chris. He goes by overlandbound.md on Instagram. You can check that out. We're gonna do a series of training videos. This video tonight is about what he carries in his first responder kit and why you should look at your first aid kit and see if it measures up. Now, if you want to be aware of future training videos, go over to overlandbound.com, become a member. You'll know everything there is to know about all our training series that are coming up. All right, that's it. Let's get right into the video. I'm going to let Chris do the talking. Thanks for hanging out with me tonight. And until next time, outfit and explore. Hope to see you on the trail.
Morning everyone, this is Chris, overlandbound.md. I'm here today. We're going to talk about trauma kits, first aid kit, what you should carry. It's a video I know you guys have been looking forward to. About me first, I've been camping and outdoors since I was 6, so almost 4 full decades now. Car camping before they called it overlanding. Professionally, I'm a surgeon, a trauma surgeon, chief of surgery over at the local hospital. I'm the medical director for the East Bay Regional Parks Flight Medic Program. I do a lot of training of surgeons. I'm an advanced trauma life support instructor. So something I'm very passionate about is teaching people how to use kits, how to use equipment, and how to actually take care of trauma patients. We'll do lots of different videos about different specifics, but today we're talking just about the kit, why you should carry certain things, why the kit that you have might be a false sense of security, and why you really should carry something like this, and this is all you need, versus that stuff over there. That looks impressive, it's big, it's, you know, exciting looking, but it's really just a bunch more of what I carry in here. First thing, most important thing is you gotta have personal protective equipment. The PPE you hear us talking about. That's gloves. This is just a box of gloves put into a baggie. You're gonna need a lot more of these than you think. Every time you touch somebody that's bloody or dirty and then you wanna go back to your kit, you should change your gloves. These are invaluable, they're cheap, buy them. The other one is eye protection. People don't think about it. These are also cheap, but you need something. Wounds splatter, things get in your eye, dirt will get in your eye. So you really need something that you can protect your eyes with. The other thing you're gonna want is something for exposure. It's part of the, we talk about the ABCs of trauma. These are shears from a Leatherman, they're called the Raptors, I like them. You can buy trauma shears that are cheap and they do just the job because you're gonna wanna be able to look at the wounds that you're addressing. So for me, trauma care is something that everybody can do. All I do as a trauma surgeon is take it to a different level, but everybody in the field is capable of providing immediate care to anybody. I don't care who you are. My kids are 5 and 7, they can apply tourniquets, they can apply pressure. So everybody watching this video is gonna be able to do something like that after you watch the full series and we get more videos out there for you. So today's video though is really to talk about what you should carry. What should you put in your kit? I'm not gonna pick on any particular kits in the market, but I'm gonna tell you from my research and looking at everything, there is not one kit that you can buy that truly will take care of multiple emergencies over multiple days or even multiple victims. So when you're talking about a kit, putting things together on your own, equipment that you know you can use, equipment that you can legally use if you have training, you better know all those rules. None of this that we talk about will replace actual training, but hopefully by watching it, you'll feel a lot more empowered and a lot more confident in being able to take care of anything. We will be bringing up specific injuries along the way in different videos. Some of you may have already seen the burn and the chainsaw ones. But that's not the point. The point is to give you a system so that whenever you approach a patient, no matter what it is, that you'll be able to go in the order of things that will kill from the most important to the least important, not skip them, and make interventions that actually make a difference. So let's move right on into what's in the kit. This is it. This is a kit that I feel confident that I can take care of 4 people with. What you really want is you really want to be able to set your kit up so that it has equipment you know how to use and it goes through the system. So when we teach trauma, we teach the ABCs, airway, breathing, circulation. There's then disability, and then there's environment and exposure. Those are your ABCDEs. The kit is set up to address those. It's going to go in the order of how we get to injuries. Now, certain injuries, you're going to have to change that around a little bit. Sometimes massive bleeding needs to be addressed first. Before the airway, different video. Today, when we open this kit, everything that I need to address airway and address massive bleeding, the first 2 things, is right there ready to go. So, this kit, I carry gloves on the outside. I've got my personal protective gear ready to go. And then as you saw, the shears are on the outside as well. I carry a headlamp because traumas don't always happen during the day when it's beautiful clear skies and things are good and you want to be able to see. Okay, so let's get into the kit. First thing when you look at this kit, you're going to notice, as I said, I've got my personal protective gear on the outside. I had the shears. That's just a convenient place. These happen to have a window breaker and a seatbelt cutter, so that allows me to get to people. That's why it's important to keep these on the outside. Your personal protective gear has to be on the outside. You do not want to, when you are amped, your adrenaline is running, you don't want to have to open your kit and try and find a pair of gloves. I've got gloves here, they're in pairs on the bottom. I pull them out, I put them on, gloves go on, I'm ready to go before I even open the bag. That's super important. And a lot of that actually is because when you get to somebody, if you've got gloves on and they have a massive bleed and there's multiple people there, you can take that gloved hand and put it right down on that wound. You don't even have to open your kit to apply pressure because you can put it down with your hand. So if you've got your gloves on the outside, you can apply a treatment immediately without even opening the bag. Even in my world, in the emergency room, in bad traumas, we still get a little frantic sometimes. So if you're not used to this and it's not something you're comfortable with, you're going to be kind of in a panic mode when you're trying to remember everything. This is also why we break it down to those ABCs, because you don't have to remember the specific of treating a certain injury, a rollover, a chainsaw, a puncture. You just have to remember airway, breathing, circulation. You get through that and you're good to go. So your kit, when you open it, needs to be ready to treat those things in the order that you think they're important. I think the kit, something like this, is perfect size. It should clamshell so that when you open it, everything you need is right there to address whatever injury you need to get to. We're going to do a video on something called the primary survey. That's where you address the ABC specifically. But the kit is set up to handle that. So for me, I open my kit. If there's massive bleeding, I've got multiple ways to address bleeding immediately. But for the airway, this kit actually has a Velcro pouch. The Velcro pouch rips off. It's got all my airway stuff in it. If you're not comfortable doing mouth-to-mouth without a CPR mask, chest compression only, if their heart isn't beating, is acceptable. I will tell you that if you're out here and somebody's heart stops, chance of survivals are almost zero, but don't give up, right? That's the point, don't give up. But this is your breathing. It doesn't necessarily help with an airway, but there are ways that you can address the airway that this helps with. But you should at least have a mask. I also carry in here oral airways. Don't use these unless you know how to use them. You can cause more harm than good. And I also carry something called a nasopharyngeal airway. Shoves right down the nose. Almost anybody can put these in. But again, if you don't know how and you're not comfortable, please don't do them. But that's your airway. Everything is right there ready to go. If you don't need the airway, if it happens to be the person is awake and talking and you clearly are breathing and their airway is okay, the other nice thing about keeping that separate is it's out of the way. I take it, it's gone, and now I can move on to the rest of the kit. For us out here, air has to go in and out, blood has to stay in and go round and round. That is it. That is literally all that you really can do out in the woods. And so everything in this kit is designed around making sure that can happen. The pump, that's the heart. If the heart's not pumping, that's you doing chest compressions. That's it, simple. Breathing has to go in and out. If they're not breathing, airway comes in. But everything else now is designed around stopping bleeding. Everything in here is for bleeding now. Number one go-to, if it's a major arterial bleed, is a tourniquet. We recommend, and we'll talk about details again, you go high up on the extremity, whether it's the leg or the arm, and super tight. There's a lot of discussion about real versus fake CAT tourniquet, the combat application tourniquet. This one is a knockoff. I feel comfortable using these because I know a lot of different ways to stop bleeding, but North American Rescue has actually agreed to partner with me in testing their genuine CAT, so I want to say thank you to them, versus the knockoff. So we're going to do some actual testing on the differences, see if these are even a viable option for people. They are significantly cheaper, so people buy them, but that doesn't mean they're better. And so we're going to try and test that for everybody, and we're going to get a video for that. But for me, I feel confident enough in what I have that this is what I will carry. So tourniquets, this kit has 2 of them, easily accessible. They both have ready to go. You open them up, you apply them, you stop bleeding in the extremities, you're done. If it's not that kind of bleed where there's blood literally pulsing, or you don't have a tourniquet, the next step, in my opinion, is going to be the Israeli emergency bandage or trauma bandage or an Izzy. It's just a gauze roll that, ACE wrap, sorry, that has a gauze roll on it, and it just wraps. It can apply pressure. They're easy to deploy. They're cheap. If it's a deeper wound or a puncture wound, combat gauze from QuikClot, that's my go-to. It's we've got some videos on that coming, plus some of you may have seen the live one on how to use it. You just take it out and you pack the wound. Everything's about pressure. Tourniquets apply pressure. Israeli bandage applies pressure. QuikClot gauze applies pressure. So if you don't have any of this, apply pressure. Just put your hand directly over it. The pressure points are the same place that the tourniquets go. Just apply pressure, that's it. This kit does a little bit of airway and a lot of things for bleeding. Most of the kits on the market, and to be honest, I have yet to see one after looking at many, many different kits that have enough gauze or blood stopping ability, in my opinion, compared to what we deal with for even smaller injuries in the hospital and what I see in the field. If you have one of these, this is going to be okay for a good size cut, but not a big cut. If somebody is a chainsaw or they fall and they've got 2 or 3 cuts and you have one of these, you're kind of already out of luck. If you're on a 5, 6, 7 day trip and somebody gets hurt day 1 and you need to take care of that wound every day, or somebody gets hurt every day, that kit is already tapped with one moderate injury, not major severe injury, one moderate injury. So I'm going to take out, it's going to be like a clown car. I'm going to take out all this stuff that is in this little bag, and you're going to see it doesn't have fluff. It doesn't have steri strips. It doesn't have Band-Aids. Those aren't a trauma item. This is a trauma kit. So Israeli bandages. 1, 2. Here's 3. Here's 4 Israeli bandages. QuikClot. 1, 2, 3. 4 QuikClots. I just have to go down there. We're running out of space. I carry 2 additional trauma pads I can get from work, but they're QuikClot trauma pads. That's 6 trauma pads. In this right here, this is just rolled gauze, a towel, because you never know when you need just something to wipe with. You can use that for bleeding. Here, ACE wrap, tape. Never have enough tape. Coban. Highly recommend Coban. If you don't want to invest in an actual Israeli bandage, Coban is an elastic bandage. It sticks to itself. You can do your own trauma pressure dressing with it. Coban is the way to go. And then now we get into the little things. This is just gauze. Okay, that's going to be great for treating minor cuts and scrapes after you have dressed the major injuries. And then over here, this is just a piece of what they call Xeroform. It's just Vaseline on gauze. If you had a penetrating chest injury, you can use this plus some tape. You don't need to have a chest seal that are expensive. And to be honest, a lot of these kits want to be tactical. When I fly, we do tactical. I fly with police officers. Gunshots are a real possibility. When I'm out here, I'm not worried about my children being shot in the chest out here. I'm worried about them falling off that rock or falling over there or having a cut because they're using the hatchet when I wasn't looking. So you don't need tactical kit. You need real supplies. So I carry that. And then this is a space blanket. I already opened it up and I vacuum sealed it to keep it safe. Because once you're done taking care of all those ABCs, you need to treat for shock. You need to keep the patient warm. So I carry one of these, and that's it. That's my whole kit. There's no fluff. Everything has a purpose. Everything in here, I feel confident that I could take care of 4 people in a pretty significant accident or multiple people over multiple days without restocking. That big bag back there is more of this, because when we go on trips, I'm the medic guy. So if someone gets hurt, they come to me for stuff, and I need more than this. And I don't want to deplete my trauma bag for everyday cuts and scrapes. So we'll talk about a base camp kit later, but this trauma bag needs to be ready to go. This lives in the back of my truck. It has a Velcro backing. Undo 2 buckles, rip it off, and I'm ready to go. As you notice, this kit, it really only has a few items. I don't want people to feel intimidated because there's all this stuff now here. There's 6 of these. They're all used the same way. And that's because you really don't need 300 different things. If you notice, I don't have steri strips. I don't have a snake bite kit. I don't have a specific knife kit. I don't have a chainsaw kit. I don't have a Jeep rollover kit. I don't have a Land Rover rollover kit, to be fair. I have a trauma kit. I have a kit that is something I can use and anybody could use as long as you feel like you know your alphabet. So if you can do your airway, your breathing, your circulation, your disability, which we'll talk about, and then looking at things, environmental and exposure, this kit will work for every injury. That's the whole point of this kit. You don't need a specialized kit. You don't need a kit with 300 things in it, and, or 150 different items. I haven't actually outed, but I bet there's only 8 things in here that are different. And that's all you need to actually do something. And what you need is a kit that you have confidence in, because you can go spend $300, $400, $500 on a kit, and it'll be in a fancy bag, and it will look cool, and it'll have a bunch of stuff in it. But once you go to use it, and you feel like you can't use it, and you don't know where your gloves are, and you don't know what this thing here is really for, you're not actually going to help that person. Like I said at the very beginning, once you get your gloves on, your hand can hold pressure. You can open someone's airway. You don't even need a kit to actually do something. It just helps. So get a kit that works for you, a kit that addresses your airway, your breathing, your circulation. Feel empowered that if something happens, you can do something. And this kit's not overlanding specific. As I said, I have one of these in all my vehicles. My family knows how to use these. You're gonna come across a car accident one day. You're gonna be at work. My wife has been at work and they've had an accident and she has used the kit in her car to help save somebody. It happens, right? 911 will get to eventually, but it's a real panicky time before somebody else who knows what they're doing shows up. So please, just get a kit that works for you. If you have questions, please find me. I'm El Solis on Overland Bound. I'm happy to help you put a kit together. Don't get caught up in the hype of a really expensive kit and feel that that actually is gonna make a difference. Because as I said, there's not a kit on the market that I feel would actually do anybody any good after about the first 2 minutes. So I wanna thank everybody for watching. I hope you've learned something. Please ask questions, and we're gonna be doing a lot of these videos, so there's gonna be a lot more content coming. So look forward to that. Have a good day.